Hi everyone, my name is Riya Patel, and today I will be talking about a prospective treatment for a certain rare anxiety disorder in the field of global mental health. Um, a brief introduction about me. I'm a rising senior at Murrow Catholic High School in the Bay Area, and some of my extracurriculars include being the president of my school's biology and science clubs, performing research, dancing, and playing the piano. Later on in life, I hope to be a doctor in the medical field. So first, I will introduce the topics in my presentation and then discuss in detail both the treatment options for selective mutism as well as its association with social anxiety disorder, and lastly conclude my research with my findings. First, what is selective mutism? Selective mutism is a rare disorder and is categorized as an anxiety disorder by the DSM-5, which is the standard classification for mental disorders. Children with SM can typically talk and interact with immediate family members in their home, but will fail to do so in front of others, including their relatives, close friends, and teachers. Selective mutism often interferes with a child's ability to use social communication in his or her life. And because of this, academic educational impairment can be caused by this disorder. The criteria for selective mutism, according to the DSM-5, is a constant failure to speak in social situations for at least 1 month, and the age that it is most seen is within the ages of 2 and 5 in children. It was initially termed and labeled voluntary aphasia and elective mutism to suggest that the child's lack of speaking was a voluntary choice. Now it is changed to selective mutism to show that the child is affected by the disorder in some situations but not in others. And a little bit more on selective mutism. It is extremely relevant to global health as it affects children in all parts of the world and impacts both their health and success in life. It also has a huge connection to other more common anxiety disorders like social anxiety disorder. And by researching selective mutism, we are closer to improving the health of people around the world, which is what global health is all about. And my work on selective mutism includes publishing my own paper and being in the process of publishing my own children's book called A Volume of My Voice. I'm also the founder of an organization called Stand Up for SM, which focuses on raising awareness about this disorder and fundraising for the Selective Mutism Association. Okay, so moving on to the treatment options for selective mutism. The two main forms are pharmacotherapy or medication-based treatment and psychotherapeutic approaches. The most used and effective pharmacotherapy for selective mutism is SSRIs, which stands for selective serotonin reuptake inhibitors. And these medications are basically clinically prescribed antidepressants that inhibit the reuptake of serotonin, which allows serotonin levels in your body to increase. With this increase, SSRIs can help in modulating mood, emotions, and anxiety levels, which are all heavily connected to the symptomatology of selective mutism. The second treatment option is therapies like cognitive behavioral therapy and family therapy, which work most effectively when used with medications like SSRIs. Next, I will discuss the association between selective mutism and a pretty well-known disorder, social anxiety disorder. Selective mutism is associated with comorbid disorders such as social anxiety disorder, and I'm going to go over some studies that provide evidence for this association. A meta-analysis found a 75% prevalence of social anxiety disorder in patients with selective mutism from a variety of case studies. There are also multiple studies that found a 100% comorbidity rate of social anxiety disorder in patients with selective mutism. And this table shows the prevalence of anxiety disorders in selective mutism patients. So when looking only at the social anxiety disorder column, you can notice pretty high prevalence rates. There are a couple that have low rates, which I looked at and found that they use different diagnostic criteria and assessed patients with the disorders in a different way than what is standardly used. Excluding these reports, it is generally accepted that there is an association between social anxiety disorder and selective mutism. This is just a bar graph showing the data listed in the previous slide, and the most important thing to notice is the high prevalence rate of social anxiety disorder compared to the other anxiety disorders in patients with selective mutism. And besides this evidence, there are studies that report similar symptoms in cases of selective mutism and social anxiety disorder. These symptoms include high levels of shyness, distress, and withdrawal. The conclusion based on this association and the treatment options for selective mutism is that serotonin norepinephrine reuptake inhibitors, known as SNRIs, would be a viable novel treatment option for selective mutism. SNRIs are a class of antidepressants that work similarly to SSRIs. They are used to treat depression and anxiety disorders, and images of their chemical structures are shown to the right. SSRIs and SNRIs are the primary pharmacological treatment options for social anxiety disorder, which is why I concluded that both of them can work for selective mutism as well. This table shows 5 case studies that tested venlafaxine, a type of SNRI, on social anxiety disorder. Most studies found a significant improvement in social anxiety disorder with the use of venlafaxine. And because there is no in vivo test or case study on venlafaxine or any other SNRI on selective mutism patients, I used the general treatment standards to conclude that they would help in the treatment of selective mutism. Generally, treatments used for anxiety disorders should be effective for a range of anxiety symptoms, have favorable tolerability, and have the capacity to reduce present and future symptoms. And because SNRIs reduce symptoms for other anxiety disorders, have low and minimal side effects, and can reduce present and future symptoms for other anxiety disorders, it can be a viable option for the treatment of selective mutism. Based on my research that shows SNRI's efficacy and reproducibility on social anxiety disorder, SNRIs can help in the treatment of selective mutism in a possibly more effective way than SSRIs. Lastly, further research should be done on the testing of SNRIs on selective mutism to conclude its efficacy, reproducibility, and safety, as this paper is the first to propose SNRIs as a potential treatment option for selective mutism. These are my references. There are quite a few. And I would like to thank my advisor for supporting me in the research and writing process to be able to publish my paper on my own research. I would also like to thank the Global Health Leaders Conference at Johns Hopkins University for providing me with this opportunity to present my work in their student speaker series. Thank you for listening to my presentation.